The movies that I chose were Brain on Fire and Girl Interrupted. From these movies, I came up with the theme treatment and onset of borderline personality disorder, also known as BPD. After watching these movies, I became interested in learning more about BPD. Through the research that I conducted, I learned that BPD is a mental health condition that affects the way people feel about themselves and others. It can lead to unstable emotional patterns, unhealthy relationships, impulsiveness, and an unhealthy way of viewing themselves, leading to potential suicide. So, through learning what BPD was and seeing how patients project symptoms in the movies, I wanted to research more about treatments for it and if its onset was identifiable or predictable. What I found was that BPD is treatable, but most of the time there is not a 100% recovery. There are three different treatments that were studied by Biskin and Paris in 2012. Those treatments included dialectical behavior therapy, mentalization based therapy, and pharmacotherapy. Dialectical behavior therapy was the first psychotherapy shown to be effective when treating patients with BPD. This therapy combines cognitive behavioral therapy with Eastern philosophies and traditions and targets life-threatening behaviors such as suicide. The study There was a study by Biskin and Paris in 2012 of patients under dialectical behavior therapy, and it had shown that there was 80% reduction in suicidal behaviors. Patients had also shown improvements in measures of anger, social functioning, and global assessment, along with the need of fewer psychotropic medications. Then there's mentalization-based treatment, which is another psychotherapy technique used specifically for the treatment of BPD. And this treatment focuses on improving the patient's ability to understand his or her own mental state. And this therapy showed a reduction in suicide attempts, reduction in symptoms, and a reduction in the use of healthcare services. So, due to BPD being characterized as a disconnection from reality, mentalization based therapy is a great option because it helps bring patients back to reality. Then there's pharmacotherapy, which is the use of pharmaceutical products, medications. This is a good treatment option, but there are some limitations for this option. The first limitation is that many pharmacotherapy trials are short, they're 6 to 12 weeks long, and BPD is considered a long lasting disorder. Second, sample sizes are small in most trials due to dropout rates. Third, patients can choose outcome measures due to most studies being self reported. The fourth limitation is the number of exclusion criteria. This is because most patients experience suicidal thoughts and multiple comorbidities. So most trials have exclusions for patients like this. So the trials tend to have patients with less severe BPD. And lastly, there's a lack of replication between studies. Most medications only have 1 to 2 small trials that show their effects. So pharmacotherapy does lack evidence and research for patients with several symptoms of BPD, but it could be a good alternative for patients with less severe symptoms or maybe just one symptom. Then the next treatment option that I found to be effective was iconic therapy, also known as IT. IT is a new therapy that uses images to teach skills with the aim of improving the symptoms of BPD. Santiago and others in 2022 compared IT to psychological interventions, which is a therapy similar to psychotherapies. The study measured the patient's change in symptoms, their suicidal ideation, behavior, self harm, the need for medication, the number of doctor visits, maladaptive behavior, satisfaction with therapy, and perceived improvement. The results shown that both therapies showed a reduction in BPD symptoms, and there were no significant differences in the effectiveness of the two therapies. But the IT group did show a greater satisfaction with therapy than those who received the psychological intervention therapy. And the effect size of the study also suggested that IT may be superior for reducing BPD symptoms and maladjustment in daily life. And I found this interesting because most patients drop out of treatments due to unsatisfaction or lack of results. So having a treatment that shows something as little as satisfaction and that has results can be the difference of saving someone's life or not. So after looking at treatment options, I wanted to look in if the onset of BPD could be identified or predicted. To start, I researched if there were certain risk factors for the development of BPD. In a study reviewed by Biskin in 2015, they found that maternal child discord, maternal BPD, paternal substance use, paternal depression, and suicidality in the adolescent could predict the future development of BPD symptoms. In 2015, Biskin reviewed several studies that studied the onset and course of BPD through childhood and adolescence. BPD symptoms can be demonstrated well before the age of 18, but studies do show that it's not yet possible to identify a precursor syndrome for BPD. And this kind of shows that BPD is definitely not something that you were born with. It's something that's developed over time. One study that was reviewed by Biskin showed that 30% of patients with BPD began self-harming when they were 12 years or less, and another percent initiated self-harm when they were between the ages of 13 to 17. And although self-harming is a symptom of BPD, there was another study that shows that after a 2-year follow-up, patients between the ages of 15 to 18, only 40% of them met BPD criteria. And then there was another study that has shown that after a 4-year follow-up, 65% of patients remitted from their diagnosis, so were no longer diagnosed with BPD. These studies can show that symptoms of BPD could be identified at a young age, but it could also be misdiagnosed due to having mental problems that show the same symptoms of BPD. There was one interesting study that defied other studies, and it showed that after an 8-year follow-up, patients with BPD symptoms tended to persist. And really the only explanation that I could come up with for how these studies could contradict each other is that the patients could have had different treatment plans, or the studies could have been based off of different BPD criteria. One study could have had less symptoms of BPD. Another study could have had more symptoms of BPD or more severe. And after looking at BPD through childhood and adolescence, I then looked at BPD through adulthood. The good thing about adulthood studies is that BPD studies in adulthood are longitudinal, and there's studies that have lasted for over 2 decades. So these studies track the disorder over a very long period of time. There's the MSAD study and the CLPS studies, and these are the two most important longitudinal studies for BPD in adults. In 2015, Biskin also reviewed the results of these studies. The MSAD studies studied 290 patients who were hospitalized with the diagnosis of BPD and compared them to a group of 72 patients that were hospitalized with personality disorders. The CLPS study used 668 patients who were diagnosed with a broad range of BPD and personality disorders. Both studies have found that over time, most patients with BPD have improvement. The CLPS study shown that after 2 years of initial assessment, about a quarter of patients experienced remission of their diagnosis. During their 10-year follow-up, 91% achieved at least a 2-month remission, with 85% receiving a 12 months or longer remission. The MSAD study found that after 16 years, 99% of patients have at least a 2-year remission, and 78% of patients have a remission lasting 8 years. The MSAD seems to be more of a successful study than the CLPS because it shows higher remission rates over longer periods of time. So to kind of wrap up, I think there's a lot of good information and studies out there that show the treatments of BPD are effective and that they can reduce symptoms, especially life-threatening ones such as suicide. And following studies like the MSAD and CLPS gives researchers good insight on how BPD can develop through adulthood. And I believe as studies continue to grow and research develops, we will also get more insight on how BPD develops in adolescence and childhood.